Okay, my darlings, it's Michaela. We are here today to talk about spasms. Last week we talked about cramping, and basically there's a little bit of a theme going on here, primarily based on what these two things consist of, cramps and spasms. So cramps and spasms are similar in the fact that they're both an involuntary muscle action. Something is seizing up, something is tightening all on its own. So cramps are a little bit different than spasms in the sense that cramps tend to last for a shorter duration. They tend to be relegated to the calves, the soles of the feet, and typically they are able to be worked out on our own. We talked about how to alleviate a cramp last week, but truthfully, even if you didn't receive that information, you would have been able to solve that all by yourself. You would have, ricocheted out of bed, you would have hopped around, you would have walked, and you would have done that flexion of the front of your shin all on your own. So spasms are a little bit different in the sense that they tend to be a bit more intense, and sometimes they can last a really long time, and there doesn't necessarily seem to be a logical way to have it release on your own. So, like cramps, spasms are a result of when one side of the body is super, super tight and the other side is really, really long in order to accommodate that tightness on one side, rather than having both things kind of being in this a toned state, a healthy state, a state where they are at an appropriate length, the length they're meant to be at. There is an imbalance. There's one guy that is just, hanging on for life, or conversely, one guy who is having his way and the other one is hanging on for life. So what ends up happening is the brain gets involved. The brain says, oh dear Lord, if we stay at this state, we are going to get hurt. So what it does is there's this neuromuscular connection, and basically when the muscle becomes way too long, the brain tells it to shorten it, tells it to contract, 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 because it wants to get back to a healthy length, a more natural length than it had been. So where spasms show up for most people tends to be in the back of the body, the neck, upper back, lower back. Okay, so when a spasm occurs, typically people complain about, oh, I bent over. So we'll address the lower back, okay? So they bent over, they picked up something inconsequential in weight, something trivial off their desk, and suddenly their back goes out. And basically, this isn't some, storm cloud that has just randomly, suddenly alighted over your head. It is a situation that has been set up over time. So we have just done this one too many times. We reached a little too far this time, and suddenly your brain gets involved and it says no, and so it starts to make these muscles contract involuntarily. Okay? The thing that is, I'm going to encourage you to view as something to take comfort in, is that your body wants to keep you safe. Your body wants to keep you stable. Your body wants to be healthy. And so know that when these things kind of come up that seem like they're out of the blue, it's your body kind of being this little watchdog to make sure that you're okay. So I encourage you to take comfort in that, because I know that sometimes people can feel almost a bit betrayed by their body. Suddenly they're in pain, they don't understand what happened, or they're incapacitated to some degree. And but truly, it is something that is either great information. What we're doing doesn't really work. We need to stop that, and or it's your body trying to help you stay safe. Okay, so. Back to the story at hand. So we're reaching for something, our muscles go into spasm in our back because we have created an unstable state for ourselves. So what tends to happen is people come in this kind of pitched forward state, and they want that area massaged, they want that area loosened, they want that area certainly relieved of pain because that area hurts. However, if we have digested what a spasm really consists of is one side being super, super tight, one side being, whoa, tweaked out because it is way too long. This is the front of the body, and this is the back. So basically, we need to loosen up this guy. So we need to deal with what's on the front of the body, okay? So what I want to share with you are some things that you could do at home in order to potentially relieve a spasm, okay? So three big things. The first one is ice. Ice is so helpful. A lot of people do not like to go this route. That is just fine. I do, and I have found it to be very, very effective, especially with spasms. We'll do a whole segment of ice versus heat another day, but I would encourage you, put ice on it. Put some cubes in a bag, stick it on your back. Use a cube, move it around, have help. If you need it, stick it behind your back, sit on the couch or lie on the couch, better, please do not sit, because it's going to continue to stretch your back. And the goal is to get it numb. That would be amazing, because basically that's going to shut down pain receptors, and it's going to shut down a cycle that could be happening. Sometimes there's this spasm pain cycle that gets kicked up, and numbness will basically short circuit that from continuing. So, all right, so icing it, potentially getting it numb, that would be amazing and most helpful. Then stretching, not the side that hurts, not stretching your lower back, stretching the front of your body, okay? And I'm going to hop up here and show you. So you want to think about the front of your hip, okay? So if we have one leg in front and one leg behind, we want to think about not sticking our butt out, but tucking it under and letting our hip drift forward. So we want to stretch the front of this right here. Additionally, as I'm here, we're going to think about the front of our thigh, pulling our heel towards our butt. We can hang on to something to do this. And then lastly, can we get all this? We want to think about sticking our hip out, stretching our inner thigh. Okay? Front of your hip, woo. Front of your hip, not butt stuck out, butt tucked under. Quad, inner thigh. All right? That is step number 2. Then we want to think about actually contracting the area that hurts, okay? If it's our lower back, we want to think about slowly and gently squeezing our butt and actually sticking our butt out, contracting our lower back ever so gently, ever so slowly. Additionally, you could think about moving your leg behind you, contracting your hamstring, contracting the back of your thigh. Basically, you want to think about what is around the spasm, because if we're really believing what I'm saying to be true, which is one side is super tight, which is the front of the body, and the back of the body has to accommodate that. Basically, the brain is making these guys contract. So if we can help that slowly and gently, we will be supporting what the brain is telling us needs to happen. Okay? So those 3 things: ice, please, 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 please do these in order. 2, stretching the front of the body, not the back. and 3, starting to contract what is within and or around that spasm, okay? Step 4 might be the need to come see a professional, because the whole thing with a spasm is that this is a time created situation, okay? This isn't out of the blue, this isn't, you know, because of that random reach that you participated with. It is more so that there is a history, there has been an accumulation of tension. So I will encourage you to be in touch if needed, and I would request deeply that you be in touch if you use this, okay? Certainly if you have any questions whatsoever. I know spasms are tricky, they're intense, they are brutal, and they can feel really delicate. So if you need anything around this, please be in touch, okay? So thank you, and until next time.